Hello, my name is Dr. Arthur Mark. I've been with Seaview Orthopedics for 21 years. My specialty is adult reconstruction, which in layman's term is total joint replacements of the hip and knee, and all the things that go with it, sometimes revisions, sometimes infections. I was born and raised in Philadelphia, and I went to college at Johns Hopkins University. I specialized in biomedical engineering. After that, I went to Temple University School of Medicine, and then I did my residency in Philadelphia at the Albert Einstein Medical Center. I then did a specialized year of training at Massachusetts General Hospital, part of Harvard School of Medicine in adult reconstruction, which is the total joint replacements. In addition to taking care of total joint replacements and all the complications that go with it and all routine total joint replacements, I also have an interest in hip fractures and trauma around the lower extremities. I also do a lot of work with arthritic patients that break their bones, and I also take care of fractures around the hips and knees quite often. I specialize in doing complex fractures around the hip, including routine hip fractures and complicated hip fractures. I also take care of complicated fractures around the knee and also fractures around total joint replacements. I enjoy being a physician because it really is very satisfying to be able to help someone. I chose orthopedics, and especially in joint replacements, because people have this condition which is a chronic in nature, which is usually painful hips and knees. And the technology is so good today that once you do the surgery, patients do very well. And it's very satisfying that you take people that were in chronic pain and pretty much get rid of their pain long term. I joined Seaview Orthopedics 21 years ago. It was a much smaller practice back then. I'm from the Northeast in the Philadelphia area, so I wanted to stay close to home. Plus, I enjoy being close to the ocean and being able to see all four seasons. Being born and raised in the Northeast part of the United States, I really wanted to stay in this area, and this is one of the most beautiful places in the country. We have great access to restaurants and culture, plus we have the ocean that's close by. My rewarding parts of my job are that I can make patients feel a lot better. The majority of my patients are a little older, and when they've been in chronic pain for long periods of time and I can get them out of the pain, it feels very good. Most of my patients are very thankful that they went through this procedure and are able to lead good lives again and get back to the activities that they put off for a couple of years. So outside of medicine, I have a lot of hobbies. I enjoy woodworking, skiing, I scuba dive. The work keeps me pretty busy, but when I'm not working, I try to do outdoorsy things if I can. And then in the wintertime, it's either skiing or I'm inside my basement tinkering around with my woodworking tools. So my family, I have two boys. They both go to school in Howell Township. I have a dog, and we are, entrenched in the New Jersey area. We try to keep active with the community. My kids, are going to public school and enjoy the soccer leagues and the baseball leagues just like everybody else. So one thing I wish I could tell all my patients, and I say this to a lot of my patients and they look at me like I have two heads, is that once you're done with the joint replacement, usually about 6 or 8 weeks, your biggest regret will be that you waited too long. Most people are really scared of surgery. You have to trust that this is what we do for a living, and that more than 1.2 million people get knee and hip replacements done every year, and the vast majority of them are very successful. That if you prolong it and put it off and say you're too old or you're not healthy enough, I don't think that's always the case. My older patients do very well. So, give surgery a serious thought especially if it's a chronic condition, in the time that it takes to get like a shot, in 2 to 3 months, you'll be feeling 100%. Having been with Seaview Orthopedics for 21 years, I've seen this practice grow. We have become one of the bigger orthopedic groups in the area that can help you with multiple problems. We have many specialized surgeons that are fellowship trained in very specific fields of orthopedics. So if you have any problems, whether it's your shoulder, your neck, your hips, or your feet, we have someone that specializes only in that field to come take care of you.